In a patient with an atrial septal defect, why does the fixed split S2 persist during both inspiration and expiration? A. Because the left atrium is always higher pressure than the right atrium. B. Because the large shunt minimizes the respiratory-induced changes in stroke volume between the two ventricles. C. Because the pulmonary valve is stenotic. D. Because the aortic valve closes later than usual during expiration. Answer: B. Because the large shunt minimizes the respiratory-induced changes in stroke volume between the two ventricles. Which of the following is a classic finding on an ECG for a patient with an ostium primum ASD? A. Right axis deviation. B. Left axis deviation and a prolonged PR interval. C. Pathological Q waves in lead 2, 3, and AVF. D. Shortened PR interval with a delta wave. Answer: B. Left axis deviation and a prolonged PR interval, due to the inferior displacement of the AV node. In the context of ASD, the gooseneck deformity seen on a left ventriculogram is characteristic of which type? A. Ostium secundum. B. Sinus venosus. C. Ostium primum. D. Coronary sinus. Answer: C. Ostium primum, due to an elongated and narrowed left ventricular outflow tract. What is the standard surgical approach for a sinus venosus ASD associated with partial anomalous pulmonary venous return, PAPVR? A. Amplotzer septal occluder. B. Warden procedure, rerouting the SVC/pulmonary veins. C. Fontan procedure. D. Blalock-Taussig shunt. Answer: B. Warden procedure. A bubble study showing microbubbles appearing in the left atrium within 1 to 3 cardiac cycles after injection into a peripheral vein indicates: A. An interpulmonary shunt. B. An intercardiac shunt, like ASD or PFO. C. Normal cardiac anatomy. D. Tricuspid regurgitation. Answer: B. An intercardiac shunt. Which physical sign is most indicative of the development of pulmonary hypertension in a patient with a long-standing ASD? A. A softer S2. B. A palpable P2, right second intercostal space, and a loud, slamming P2 component. C. Disappearance of the systolic murmur. D. Development of a bifid pulse. Answer: B. A palpable P2 and a loud, slamming P2 component. When performing a cardiac catheterization on a patient with a secundum ASD, where would you expect to find the highest oxygen step-up? A. Between the SVC and the right atrium. B. Between the right atrium and the right ventricle. C. Between the right ventricle and the pulmonary artery. D. Between the pulmonary artery and the aorta. Answer: A. Between the SVC/IVC and the right atrium. Which of the following conditions is considered a relative rather than absolute indication for ASD closure in an adult? A. QP/QS ratio of 1.8. B. Recurrent paradoxical embolism. C. Presence of a small, asymptomatic ASD with QP/QS1. 2. And no RV enlargement. D. Documented orthodeoxyaplatopnia syndrome. Answer: C. Presence of a small, asymptomatic ASD, usually monitored rather than closed. Platopnia orthodeoxia syndrome, sometimes seen with ASD or PFO, is characterized by: A. Dyspnea and deoxygenation triggered by lying flat. B. Dyspnea and deoxygenation triggered by sitting or standing upright. C. High blood pressure when standing. D. Improved oxygenation when sitting up. Answer: B. Dyspnea and deoxygenation triggered by sitting or standing upright. During a fetal echocardiogram, why is it difficult to definitively diagnose an atrial septal defect? A. The heart is too small to see the septum. B. The foramen ovale is normally open and shunting blood right to left in utero. C. The lungs are not yet functional. D. Fetal blood has the same oxygen saturation in both atria. Answer: B. The foramen ovale is normally open and shunting blood right to left in utero. Which of the following describes the rim requirements for a successful percutaneous Amplotzer device closure of a secundum ASD? A. No rims are required, the device anchors to the valves. B. At least 5 mm of tissue rim around the defect, except potentially the aortic rim. C. A minimum of 20 mm of tissue rim in all directions. D. Only the inferior rim must be present. Answer: B. At least 5 mm of tissue rim around the defect. Which of the following is the most likely reason an ASD remains undiagnosed until the third or fourth decade of life? A. The defect only forms in adulthood. B. Left-to-right shunting is often asymptomatic until the right heart compliance decreases or the shunt increases over time. C. The murmur is always extremely loud and easily ignored. D. ASDs usually close spontaneously in adolescence and then reopen. Answer: B. Left-to-right shunting is often asymptomatic until right heart compliance changes. Post-procedure management for a patient who received a percutaneous ASD occluder device typically includes: A. Lifelong bed rest. B. 6 months of antiplatelet therapy, e.g., aspirin, and endocarditis prophylaxis for 6 months. C. Immediate heavy weightlifting. D. Permanent anticoagulation with warfarin. Answer: B. 6 months of antiplatelet therapy and endocarditis prophylaxis for 6 months, until the device is endothelized. What is the most common direction of the shunt in an uncomplicated ASD? A. Right to left. B. Left to right. C. Bidirectional from birth. D. No shunting occurs. Answer: B. Left to right, due to higher compliance of the right ventricle compared to the left. Which of the following is a non-cardiac finding that may suggest a sinus venosus ASD? A. Clubbing of the fingers. B. Scoliosis. C. Abnormal drainage of the right superior pulmonary vein into the SVC. D. Polydactyly. Answer: C. Abnormal drainage of the right superior pulmonary vein into the SVC.